Hi, everyone. My name is Kacie Geretz. I graduated from Ohio State's RHIA program. I now work at a company called NIM Health, and I'm the RCM Solutions Lead. I'm going to talk about in this session autonomous medical coding. I'm going to talk through, the evolution and why it's coming about. I'm going to then dive into kind of the technology and how it works. And then lastly, talk through, the impact it's bringing, and then also what it means for HIM professionals. So starting with that current state of medical coding, when we think about the evolution of medical coding, originally it was very manual, looking at code books, writing down on claim forms, snail mailing that to the payers. We've now transitioned in the past, 20 years to electronic workflows and our EMRs, as well as utilizing tools such as the CAC to really help efficiencies when it comes to medical coding. And then now we're transitioning into this era of autonomous medical coding and utilizing artificial intelligence, which is scary in itself. But there's a lot of benefit to it. And to that point, I want to just make a little bit of an analogy, if you will, to search engines and how we utilize this technology in everyday life. So, if we take it back to a similar stage as the previous slide, originally to search things or to understand things better, it was looking through encyclopedias. Most recently, and really what I know in my generation, it's using ask.com, it's using Yahoo, it's using Google. I think I say I Google for everything when I say I search for something. And now we have this new thing, ChatGPT, or semi-new, as of this year, which if you played around with it, it's really interesting. If you haven't, you should. It really does, it has some use cases that does very well. In some instances, I think it needs to work a little bit on referenceability or accuracy. So for example, if you tell it to code something, sometimes it'll make up codes that aren't true diagnosis codes. But for example, I used it to plan my vacation. Instead of Googling and looking through ratings and reviews, I said, hey, in this area, give me a resort with this rating and this price range. And it was great. It saved me a ton of time. So the whole point, what I'm saying is whether it's in everyday life or in our careers, that technology is evolving to a place that it can really help us be more efficient in our jobs. And that's what autonomous medical coding is trying to do. So thinking through, again, true current state, what are those coding technologies out there today? We have the inherent EMR functionality for anybody that uses Epic. Simple visit coding is an example of this. So simple visit coding, it helps in some processes, but it's not intelligent. And what I mean by that is it's truly just pulling discrete data fields within the EMR and pushing it through, your coding and billing workflow to make it onto the claim. So it's not reading anything. It's not reading reports, notes. It's truly just a data pull essentially. CAC solutions, a step above, it's utilizing natural language processing, it's suggesting codes and trying to make more efficient workflows for the coders, but you still have a coder touching every chart. They have to review that suggestion. They have to either accept it, edit it. So it still involves that human interaction, where autonomous medical coding does not. And really, there's not much of workflow changes. And I will go through kind of the workflow here later. But I think it's important to highlight that accuracy, because with coding, accuracy is always first and foremost top of mind. And these autonomous coding solutions are truly hitting those accuracy marks. And the most important part is that a consistent manner, because it is an engine. So once it's trained or configured, it then truly always does it that way. So how does it do that? I want to dive into some of the underlying technologies to autonomous medical coding engines, because there's a few different variations out there on the market. So from a high level, it's all artificial intelligence. When you start to break it down, you kind of have your machine learning based engines, and then you have your more natural language processing and those large language model processing type of engines. Artificial intelligence is really the overlying technology. Machine learning and natural language processing are both subtypes of artificial intelligence, just with different approaches. To use an analogy again, I think it helps with conceptualize some of these concepts, but if you think about AI, it's kind of like the coach of the team. It's the brain of the team. They're making decisions for the players. They're giving orders. And then machine learning are like the players on the team. So from past experiences, as they continue to learn, they're making adjustments in how they approach different situations or different plays. And then your natural language processing is where it's kind of the playbook of the team. So it's really understanding the components of the team and the inner workings, and then being able to communicate within that team itself. Let me take this back to our autonomous medical coding engine. So you kind of have two types. You have the mostly machine learning based models where it's learning from lots of data and really starting to make predictions based off of that data and those past experiences, if you will. And then you have your natural language processing type of engines that are truly more understanding the documentation to then apply those code sets. There's pros and benefits to both. I think it depends on the use case of what's needed and where the autonomous medical coding is needed. But I think it's important to really vet each vendor if you are a health system or provider looking at these vendors, and really truly understand the underlying technology, because it makes an impact in the results. So when you think about the workflow, and this is pretty synonymous through each vendor, typically each vendor is going to integrate with your EMR, and not to have any front-end tool for the coder, but more to pull all the documentation from each encounter. It's then going to process through those encounters, and then for any of the encounters it was able to successfully fully code, meaning your diagnosis codes, your CPT codes, modifiers, provider attribution, all that fun jazz. That will then go to billing. And then for any of the encounters where the engine had a drop for whatever reason, which I'm going to cover here in a second, those would then flow back to your typical coding workflows, almost like it didn't miss a beat. They're just flowing back to your human coders. Typically, there's some type of indicator flag of why the engine couldn't code those, and then it's up to the human coder to process through those. So as I mentioned, as I was just covering, it's not 100% solution. Autonomous medical coding from any vendor is not a 100% solution as it sits today. Really quickly, so we're all on the same page around definitions. When I talk about covered charts, what I mean is, say an engine receives 100 charts, how many of those were able to be successfully fully coded where they were going to that billing workflow and not down to that non-coded area within that workflow on the previous slide. And then from there, for any of the ones that were in that non-coded or dropped encounters, you can kind of break it down to 4 reasons. First is that engine understanding gap. So a lot of these companies that are getting into autonomous medical coding, they're relatively young. Call it 3 to 5 years. And although the technology is there and really the development of the engine is there, there's still a lot of specialties, a lot of development to be done. So it's not, again, 100% solution. So there's going to be gaps. But the nice thing is, it's being accurate, because if it's dropping for any reason where it can't understand the chart, that it's truly understanding the ones that it is able to code. Second would be a conflict in documentation. So this would be where there's maybe ambiguity or a left here and a right here, where typically a coder is querying the provider anyways. That's essentially what number 2 is indicating. Number 3, partial coding. This could be, again, where the engine's going to prioritize accuracy over completion. So maybe it's able to code majority of the chart, but it's unsure in a certain situation of the coding, it will flow this back to the human coder. And then the last one is really more administrative, in my opinion, but this is around, missing ED notes, missing provider signatures, maybe an attestation from a teaching provider. So I want to talk about, what are the benefits that we're seeing? What are some of those limitations around autonomous medical coding, really across the vendors? First would be keeping in mind right now, most vendors are live in outpatient type of service lines or specialties. That's quickly evolving. I know my company and another have started on some inpatient pro-fee type of coding. So that's, quickly not becoming the case. Another one to highlight that I think is really important is it's not 100% solution. So if you're a health system or working on a provider and thinking about autonomous medical coding, and you need 100% coverage, you don't have any in-house coders, autonomous medical coding is probably not going to be the solution for you unless you're willing to partner with, some type of contracting human coders and that autonomous medical coding solution, which I've been a part of some of those situations and it works well. So it's just kind of depending on what type of coverage you need. But the benefits, again, it's an engine. So it's consistent, it's fast, it's adjustable to whatever is needed. So a lot of times I'll get the question, are coders kind of defensive or mad when your company is coming in to implement the engine? And my answer is no, because typically we don't have customers coming to us saying, hey, I have way too many coders. We need to, use the engine because I need to, through fruition, transition to the engine, to say it in semi-nice terms. But that's not what we're being asked. That's not what we're being told. We're having customers come to us saying, I need help. I have backlogs. I can't fill, coding roles. I have people retiring. Vacations are happening at the same time. Holidays are happening, and we are drowning. And that's where they're typically coming to us. So it's helping kind of alleviate that stress, that pressure, those backlogs. So when a health system or provider is implementing an autonomous coding solution, I think these are kind of three key areas to really focus on. So one is being that training. So I think it's important when you think about it, your autonomous medical coding engine, to think of it as a new coder that you're onboarding. You want to teach them about your facility or organization's specific coding guidelines, philosophies, because with coding, there's subjectivity, there's some gray. So it's important to really partner with your vendor to make sure you're aligned on those coding philosophies, or they're making any updates or tweaks to your engine for your coding philosophies. Second, really aligning with what does validation of those of those autonomous medical coding results look like? What is the vendor doing? What are you going to do internally? How are you coming together, looking at those results? How are you viewing that? How do you define accuracy together? So a lot of really important things to make sure that your vendor is going to be a good partner with you. Last would be, how are you going to evaluate and look at that performance improvement? What are the KPIs that you're trying to impact? What is the vendor going to be measuring for you? How will you measure it internally? And again, ensuring you're on the same page so that you're really making that impact and gaining the efficiencies where you're hoping to. This is really just to highlight and give a glimpse of where autonomous medical coding engines kind of started across the vendors. So really that was kind of radiology, pathology, ED, and really looking at the large scope of specialties and service lines, whether it's clinics, surgeries, inpatient pro-fee, your therapies or some more ancillary services, of what can still needs to be developed and tapped into. And I know, again, personally, internally at my company, we're developing these rapidly, truly currently, to be able to help code in a lot of these other areas. But understanding we are still really in some of the initial, we're further than initial, we're down the line a little bit more, but we're still not to the full maturity of being able to handle everything. No vendor really is at this point. So I think it's important too to understand, who do I want to go down this journey with, because it's truly going to be a journey, right? You're starting in certain areas and you're just continuing to expand. I think it would be a shame not to mention, what are some of those other use cases outside of just truly, here's a discharge encounter and code it, that can go through the engine. HCC coding capture, I think, is an interesting one as we start to really focus on the outpatient realm and looking at those RAF scores and understanding value-based payments. But, utilizing an engine to do some of those HCC coding audit validations. Is the documentation there to support the codes captured? Also, are there any missed opportunities, misdiagnosis codes, quality audits? Do you need to have a manager QAing your coders anymore? Can you run those encounters through the engine? And then lastly, one I always have to mention is near and dear to my heart, because I was a revenue integrity charge master person at a hospital I worked at. But, can you utilize an engine to do some charge reconciliation type of audits to ensure you're capturing everything you can? This is typically something I leave and I talk through with any potential health system or provider looking to implement a autonomous coding solution. So one, I think, is really just having a strong understanding. What are those current coding challenges? Are you trying to resolve for DNFC? Are you trying to resolve for denials? Are you trying to resolve because you just don't have enough staff? So I think just ensuring you're communicating those to your vendor is always helpful to really understand, what are those challenges? What is the why behind doing this? Secondly, understand internally, what's your technical capacity for a project. I will say, in my opinion, implementing autonomous coding engine, it varies vendor to vendor, so that's important to understand, but I don't think it is as big of a lift as some technologies can be, or at least from my experience. But it's still a lift, and you still have to understand what's your capacity, what is the resource need from the vendor, and kind of go through that process. And then the last, and I actually think is the most important, is what is your organization's coding philosophies? Whether this is around Z codes, secondary diagnoses, whatever it may be, meet criteria. Really having a strong understanding of how you're training your coders and what that coding philosophy is, because you want to ensure that you're being aligned and transparent with that autonomous medical coding vendor once you decide to partner with them. Because again, they're going to, or they should be consistent with your coding philosophy. So to be able to communicate that clearly is really important. The last thing I'll just touch on in this presentation around autonomous medical coding is, as we talk through HIM professionals and how this could impact different career paths, I kind of broke it into two areas. One being whether you're working for a provider, health system, whoever it may be. These are kind of the different career paths I could see. One, as I mentioned, it's not 100% solution, so you still need coders. Secondly, auditors. I think auditors are going to be really important, but it's going to be interesting because these auditors are going to be able to be proactive in some instances with the coding engine instead of always retroactive, not always, but instead of sometimes, being more retroactive in those quality audits or your coding audits or whatever type of auditing you're doing. On the flip side, when we talk about working for a vendor, there's a couple different ways to go. You could, again, be some type of auditing role, but instead of auditing a human, you're now auditing the engine. You could be on the product team, whether that's, as a subject matter expert, kind of helping them understand the why or the challenges or how to really design the product, the solution, develop it. And then last, I think is really important is compliance. So every vendor needs, the same type of structure as health systems or providers do around what is compliant coding, what are the CMS regulations, policies. So keeping up to date with those and inherently keeping up to date with, or keeping your product team up to date. If you want to learn more, feel free, scan our code here, go to our HEMA revenue cycle area. There's a lot of great resources out there. I just want to thank you for joining. Thank you for listening. If you have any questions, please feel free to reach out to me. Happy to address any of those. Thank you.